Welcome to the Unlocking Senior Resources podcast by Leave the Key. I'm Larry Wagner, and I've spent 30 years working with seniors where I was a certified senior advisor and the last 15 years in the home buying industry as a certified senior transition specialist, where I specialize in dealing with seniors going through a transition in their lives. This podcast is for seniors, those with seniors they love, and people who work in the senior community. In each episode, we bring on a guest who works to improve the lives of seniors. This podcast is your key to unlocking senior resources. Welcome to the Unlocking Senior Resources podcast by Leave the Key. I'm Larry Wagner, and I've spent 30 years working in the senior financial advisory space and the last 15 years in the home buying industry, where we specialize in dealing with seniors going through a transition in their lives. This podcast is for seniors, those with seniors they love, and people work with the senior community. We bring on guests who provide important services for seniors, and today I'm with Nicole Christensen. How are you today?
I'm well. Thank you for having me, Larry.
Very good. Well, welcome to the podcast. And you're a patient advocate. Can you please tell me about the company that you started, as well as how you got to this part of your life?
Sure, absolutely. So yes, my company is Care Answered. We provide patient advocacy and care coordination. And how I got there could be a long story, but I'll shorten it up for you. I got my bachelor's of science at Baruch in New York, and it was for psychology. Then I did a year of service in Washington, D.C. In that year, I provided senior advocacy, and it completely changed my trajectory. So I came back to New York and got a master's in urban affairs, which is advocacy and nonprofit management. And I worked in a number of nonprofits in the city and on Long Island, as well as DC before, providing advocacy and managing all sorts of nonprofits. And so what happened in my experience is I saw all of these things happening, all of these services and care not being received by older adults. And I'm not sure if you're aware, but preventable medical error is one of the leading causes of death in the United States.
I did not know that.
So what that means is people have misdiagnosis or medication errors, things like that, in which they're not getting the care they need because it was preventable. So it's not like something happened and, people pass away and that kind of thing. This was preventable medical errors. And in my experience, both professionally and personally, I've seen it happen in real time. So my oldest brother, I'm the youngest of six.
Oh, wow.
Which I always say with so much pride, as if I had anything to do with it. But my oldest brother, Joseph, passed away of a preventable medical error.
Right.
And of course, it wreaked havoc on our family. And then if you fast forward some years later, my dad, who had a diagnosis of Parkinson's and Alzheimer's disease, and he was hospitalized and then was supposed to spend a short term in rehab, a skilled nursing facility, and they didn't give him his medication. Mm-hmm. Again, a preventable medical error, that led to him to lose all capacity. Mm. So when I say I blame my dad for Care Answered,
yes,
it was the last thing that pushed me over the edge that said, there are so many people, older adults and their families, and everybody else who's a patient, really. Right. But that's where we focus our strengths. It was older adults and their families not understanding how to navigate through the healthcare maze. And we're here to do that for them, to be their partner in care.
Fascinating. It's unfortunately a terrible story to get to where you are today. Dealing in the senior community, as we all do, there are wonderful happy stories, but there are probably more unhappy stories. It's just the nature of what we do, as opposed to working in a maternity ward, which is probably the opposite. We're at the other end of the scale of life, and I'm dumbfounded. It's such a story. the question for you is, what do you do during your day as an advocate? What is your role there? I know what your role
Every day is
technically is.
different.
Yes, that's what makes it interesting.
Every day is different. So at Care Answered, and what I do as the founder and the CEO is I'm feet on the ground,
Right.
right? So people call me generally for care needs that they have when they're in a transition.
Right.
And what that means is when you are given a diagnosis,
Right.
or it's not a recent diagnosis, but you've had a health decline.
Right.
You're trying to figure out, the family often is
Yes.
trying to figure out what we can put in place to make it safer, to bring about quality of life. Because as you said, Larry, it's the other end of life, but there's so much quality
Right.
and happiness in that stage of our lives.
Yes.
And what we want to do as loved ones or friends or neighbors or just fellow people on
Yes.
this earth, we want to have that quality of life. And so we try to make that happen. So again, with transition, it could also be somebody going into a hospital,
Okay.
somebody being discharged from a hospital, going into a skilled nursing facility, coming home from a skilled nursing facility, trying to figure out what insurance might cover to give them that quality of life and get their care needs met. We work a lot in New York on community Medicaid, which provides care in the home. We also work a lot with long-term care insurance. So not to purchase it,
Right.
but just like all insurance, right?
They fight.
Exactly. You purchase it, and it's when you're trying to receive the benefit
Right.
that it becomes an issue. And we're there to make sure that people get all of the benefits and the
Right.
care that they need.
Right. It's funny you say that. Again, my mother, she had dementia. She had Lewy body dementia.
Oh, yeah.
Yeah, it was just the horrible last 3 years of her life. But she received her long-term care benefits, and they first said no, and I'm the one who sold the policy. It was my job at the time, and I was able to stand up and fight for her. But after like a month, they stopped fighting, and that they saw her medical record. She was basically a vegetable at that point. But yeah, but they didn't want to pay. They didn't want to pay.
Yeah.
And that's their job, is to collect the premium and not pay out a benefit.
Yeah, and hopefully not have to pay.
And not have to pay. And they fight, and they need people like you. She had me, who knew how to run the system, because I'm the one who sold the policy. Was my universe. But people don't have that.
Yeah, and also for that, something that people really should know is have your policy,
Yes.
because people, what happens is they get their monthly information and to pay,
Right.
but they don't know where their policy is. And I've had a lot of folks that came to me that they were like, well, I'm going to look for the person that sold my policy.
Okay.
Unlike you,
Right.
those people are nowhere to be found,
No.
and it also,
Right.
many of them have had the policy for a very long time. Those people could have not been in the business anymore, just like you're doing different things
Correct.
with your life. And so it's really important. I'll tell you a brief story about somebody that was in transition. I met a woman, and we were just on the train train platform, and you know how these things happen.
You talk to people who you don't know. I get a lot of flack for doing that from my family.
People come up to me. I must have one of those faces.
That's it.
But she was saying, we were talking, and she was talking to me about her sister,
I know.
who was a dynamo. Like, she was the first woman on the stock exchange or something crazy. She was so interesting.
Right.
But she had definitely withdrawn, and she was very anxious, and they knew that she had this stellar long-term care policy. And I said, just, if you want, talk to me and I'll go through it. So I went through it, and I realized that her current diagnosis from her doctor was going to be anxiety.
Right.
And I also realized that they would not cover that as a primary diagnosis, her
Right.
long-term care. So I got into place appropriate doctors. So it was a geriatric neurologist and geriatric psychiatrist to do tests, and they recognized that there was atrophy to the brain, and she was.
Oh.
It was a symptom
Right.
of her dementia. So it's unfortunate that she's going through this, but without that, they would not have gotten their policy, and it's really hard to change a primary diagnosis. So getting that let her able to reach all those funds that are going to help her live out the rest of her life, getting the care she needs.
Long-term care policies are wonderful if you need them. And people don't want to buy them, say they're afraid they're not going to need them. They come out with alternatives and so on. That's not the point of this discussion, but they're life-changing. When you need them, and if you have them, I've never sold one that wasn't big enough to be life-changing as far as the amount of length of benefit or the daily amount of benefit. They're just so expensive that people aren't buying them anymore.
Well, it's a new day now. It's a new day. My dad, he was not one for a lot of forethought, but I'm guessing my mother had something to do with it. But he had a long-term care policy. And the other thing is, with all of these transitions of care, is the children, if it's adult children, they often don't have conversations like this about what I have available. I want to make sure you guys all know that I have this and this and this. It wasn't a conversation. Hopefully generations to come are more open and having those conversations. I preach about it all the time, but also having those conversations about care. What do you want? When we were talking about quality of life, one of the other things that Care Answered provides is the care control partners. So we help facilitate the discussion regarding healthcare proxy. What do you want to happen? Right. And a lot of people are healthcare proxy by surprise. Yes. And that is no fun. That is really torture for that person. So having those discussions of people think of it as it's morbid, and it so isn't. It's how you want to live.
That's the right word. Morbid. People don't want to talk about it. It's taboo.
Right. Yeah. No, I say in my book as well, nobody has died from making a will that's not been on anybody's death certificate. Nobody dies from creating a healthcare proxy. That is not a thing.
Cause of death. Wrote a will.
Exactly. You will never see it. And the peace of mind that it gives your loved ones and yourself to know that you've had those discussions and what you want is going to be carried out. And you can change your mind. It's not written in stone. You can change your mind.
Absolutely.
And so that's why those discussions, it's so important to have them more frequently rather than less frequently.
I spent so many hours trying to convince my older clients, my clients of the age of generation of my parents. And so I went in the financial business in my early 30s, left in my 60s. And so we sort of grew up together. So my clients were in their 50s and 60s, and they moved to their 90s. And in that time, they went from never talking to the kids. When they're 60 years old, the kids don't have to know my financial issues. By the time they're 70, some are coming around, 80 more so. And I used to beg them to include their kids. And my kids know exactly where everything is, what everything is. And then my son became my business partner, which now, since we're investing in real estate, everything's there. But it's so freeing because the password to financial information was keep out Ben. Ben's my son, because I didn't want him to know. So that was my password. So I was just like them after telling them for 30 years to include your children. I was excluding my own. My daughter had no interest. She's not a financial person. My son always was. And then I said, what am I doing? I'm doing exactly what I've been telling everyone not to do. So apparently it's human nature, because I knew better, but yet I was doing it. So sometimes we have to get out of our own way. We have to learn. We intellectually know what the right thing to do is. We have to actually get up and do it. It's out of our comfort zone. We've got to get up and do it.
I think it's a human, or at least in the United States, a very common trait to feel like we have to do everything ourselves. Yeah. And that has never been the case in any person ever. Right. That you can get by on your own. Correct. That is not a thing. Right. I don't know why we place it on a hierarchy, or you put it on a pedestal. Yeah. It just doesn't make any sense. We're all here for each other. Without people in your lives, we saw in COVID. Yes. Right. That time of being isolated. It killed people. Yeah, literally. It literally killed people.
They didn't write cause of death isolation, but we know.
It was. But it was, yeah. Right? Yeah. It's kind of like a broken heart. Yeah. Same kind of thing. Right. We, as human beings, need each other. Yeah. And there are services out there. We use all sorts of services that we don't need, right? Do people generally cut their own hair? No. Do people generally, even nowadays, you need a computer and I don't know what you need to fix your car now. Right. But Do we do that? No.
Right.
So then these people that are the most important to us or ourselves,
Right.
why wouldn't we get people to assist us?
You're correct. Funny you see the things that we can do and we don't do. The example I always use is mow your own lawn. Why the companies still make lawnmowers, I don't understand, because nobody mows their own lawn around here anyway.
I do.
We do too. We did until 4 years. When I turned 60, actually, I stopped mowing my lawn. I gave my lawnmower to my daughter. But now they're moving back here, so they're going to be mowing the lawn. Nobody does anything for themselves because we rely on people for everything, but we don't want to rely on our own family. We don't want to ask our family for help. And who better to ask than your family?
Exactly.
Who more likely wants to help you than your family?
Exactly. And when it comes to anything that we need for our family or people that we love in general, we can't be the experts in everything.
Right.
You know, as at Care Answered, I know a lot of stuff.
Right. I know
So
a lot of
do you.
stuff. Right.
And so do a lot of
I'm
other
glad you
people.
say it that way. With confidence, I know a lot of stuff.
I do. I know a
Right.
lot of stuff
About what you do.
about what I do.
But I
And
bet you rely on people for the things you don't know.
Absolutely. Absolutely. And the key is that in the situations like we talked about, in the situations of transition, we don't even know what we don't know.
Correct.
And so it feels so lonely and isolating when you're caringiving like that.
Right.
So I quoted it in my book, and I'll quote it again.
I was going to ask you about your book in a moment. Go ahead.
Sure. It's there are only 4 people in life. This is from Rosalind Carter, right? There are those who are caregivers,
Right.
those who will be caregivers,
Right.
those who will need caregivers, and those who have been caregivers.
Right. I say were. Right.
Yeah.
Right. Yeah.
And so it's all of us.
Right.
And it's something like 48% of the working population, adults, have provided care for an adult loved one in the past 5 years. And 49 believe that they will be providing care for a loved one in the next 5 years.
Wow.
That is very close to 100%.
Wow.
We are not alone here, and you should not go through this alone.
Well, we relied on other people. Again, we had an aide and a wonderful aide, supplied aides from my mother. But when we lost both my parents about 2 years apart, again, about 5 years ago or so, I also felt that it was such a blessing that my wife, who was like a daughter to my parents, they lived close by, were able to spend so much time with them and had the goodwill, I'm going to say the good fortune to be able to assist them when they need our assistance. And we work with my in-laws now. I mean, they're older folk, and they need a hand, whether it's driving to the doctor or just dealing with things they can't deal with any longer. I consider it a tremendous privilege. And people think of it as a burden, and it's a burden I wouldn't want to live without. And I'm hoping 30 years from now, if I need care, that my kids will feel the same way. And quick funny story. When my kids were little, I mean little, like 8 and 10, my son would say, "Dad, I'll supply with all the money you need when you get old and sick, and Hannah will take care of you." And I think now 20 years later, 20 plus years later, the personalities are probably still the same. We are who we are, but you have to know your place. But you could be an advocate, because even with your job, you still involve family in what you do. It's not you alone.
No, absolutely. So we're a part of the care team. Right? So we're kind of like a quarterback, to use a sports metaphor, which I generally wouldn't use, but somebody told me that, and I was like, yeah, that makes sense. So we make sure all the care is coordinated. So, for example, I have a client in the hospital now. One of the things that they're in a rehabilitation facility. And one of the things is to get all the records from the hospital, get all the records from the rehab, get in touch with all of the community doctors, and then make sure that and then bring that all so that we can schedule a care plan meeting so that we all have all of the information. Because what we do at Care Answered is to make sure that we have the information so that you know all of the options available. Right. We're not making decisions for you.
Correct.
But it's hard to make the right choice when you don't know what the choices are.
Correct.
And most people do not know what the choices are. So we're there. Most of the people that call Care Answered or a loved one, whether it's a spouse
Right.
or a niece, nephew, adult child, or a really good friend, what have you. They're the people that love them. Because when we're the patient, it's hard to go back to
Yes.
your like, oh, I don't need help.
Right.
It's hard for us because if we're a patient, because we're all patients, but in a particular crisis type of moment, because we're trying to heal, we got a lot of things kind of going on in our body or in our mind and everything else. And also, we don't want to be a burden.
Correct.
So it's so important for everybody to have an advocate. And that advocate may not be the person who loves you the most.
Right.
Or who you believe loves you the most. It's the person who can act on it, that has the knowledge so that they can make your wishes
Right.
and put them into place.
Right. That makes a lot of sense. And people have to understand it's life is a team sport. And
that's great. I love that.
And this, I've never actually said that before.
It's great. We're going with the sports metaphor.
And there's no guy less sports oriented than me. And I made 2 sports metaphors yesterday. I don't know where those came from. Next, I'll start making some for cricket or something. I don't know. But but with that said, my father-in-law, he always, whenever I take him to the doctor, he says, I feel badly, I'm burdening you. And I tell him, well, first of all, it's not a burden. Second, if it weren't for you, I wouldn't have my wife and children. So it's a small price to pay for my wife and children. The people who need the care want to suck that privilege away from those who want to give it. And they don't understand necessarily, not all caregivers do it with the same attitude. And I'm not naive to think every caregiver is a caregiver and they feel great about it. But many do. And at some level, most get some personal satisfaction out of it. I'm not saying it's not inconvenient. Not driving to the doctor is easier than driving up to the doctor, but I wouldn't give it up. I block it out of my calendar, which is a full calendar. Make sure no one makes appointments with me during that time.
Right.
Again, it's a privilege, but I know what I know. I know how to drive him to the doctor, but I don't know what you know. Right. And I would never try to take on your role. And I'm a pretty smart dude when it comes to this stuff, spending 30 years with the senior community and so on. But this, first of all, in the last 5 years since I left that industry, things have changed radically, and they changed 5 years before that and 5 years before that.
It's changing all the time.
And I think it's changing at a more rapid rate in every parts of our lives than it ever has in the past. 1960 to 65 is probably a smaller gap than it is 90 to 95.
Because of technology in general.
Absolutely.
And so many breakthroughs,
Correct.
Thankfully. But still, also some of the same issues, right? I still see the same things I started 25 years ago. I still see the same things going wrong,
right,
as I can see now.
I just at a wedding this weekend, and my brother-in-law's, I'll call it historian, that's his hobby, loves history, and we talking about famous quotes about today, and the troubles what ails society today, which are basically identical to things Thomas Jefferson was saying. So, things don't change.
Yeah.
We're talking about how much things are evolving, but it's the same core. We're just dealing with it differently. And we didn't have long-term care insurance. That's a new issue, but people still need care.
Right.
So that's the change. The change is not in needing care; it's how we deliver care.
Right.
And
the age of people that need care.
It's radically different.
We weren't alive.
We weren't alive.
The amount of time that we were.
Hi, I'm Larry.
And I'm Ben. We're the father and son team of Leave the Key Home Buyers, and we want to buy your house.
We specialize in working with seniors who are transitioning out of their homes, and we understand what you were going through.
So if you're considering selling your home and would like an alternative to the traditional overwhelming process, reach out and see how we can help.
Do you have an outdated home?
No need to update anything.
Have a home that needs repairs?
Don't bother with repairs.
Don't want to take everything with you?
Leave whatever you want behind.
Dreading the headaches that come with agents?
Sell your home without paying a commission.
Dreading prying neighbors attending open houses and passing judgment on your home?
No need for public showings.
When you sell to us, you'll have all the certainty of closing on your timeline, not someone else's, and there's absolutely no pressure.
Visit leavethekey.com or call us today for a no-obligation offer at 631-388-7771 if you want to sell your home today.
People have to understand, so I want to ask about your book. Before I do that, so if you to sit there and say specifically, if somebody okay, my mom, okay, I mentioned she had Lewy body dementia. I now am saying, oh God, she's living at home. She can't stay at home anymore. She was just diagnosed. I know she's going to deteriorate. I call you.
Mhm.
What do you do? I mean, specifically, what do you just, you touched on it before. I want to repeat that again. 'Cause that's probably the most important part.
So the first thing that I do for clients is do an intake.
Okay.
Because I can't advocate if I don't know what's going on, right?
Fair.
So I need to know what's going on. And then from there, I let folks know, okay, based on this information, these are the options. Many people are blown away because they had no idea that there was as many options
Right.
as they think. I've just told them. So then I tell them the options. And then, so for example, I would say, okay, I know how Lewy body
Right.
goes through life. However, some people, some of my clients may not have asked that of their doctor, right? They might be scared.
Right.
My job is not to tell them my experience
Right.
with my different clients. That's not appropriate.
Right.
But what we're going to do is we're going to have another call or use the portal or what have you
Mhm.
to contact that clinician and say, what does this mean for me, short term and long term? I just want to make sure I have all my ducks in a row so that they have that information. Again, making sure people know the options available.
Right.
And then what is it? Maybe it's in your case, in your family's case, I want to really stay in my home for as long as possible. So what do I need to make that happen?
Right.
So then we, again, speak with other clinicians. I have my experience, but I'm not going to pretend I know everything.
Right.
We're going to go and make sure that we know all of the things that we could have in place to make her life most comfortable.
Right.
And then you say, okay, so this would be the case. And then at some point, you're going to need more help than that. What would you like to do? And so if her husband's there, and if they're about the same age, which happens often,
Right.
what happens, they'll be like, oh, I'll pick her up. I'll take care. It's like, no, that's not going to happen.
I've
Why?
been through that.
Yes. Why? Because she counts on you, right? So and other people probably count on you as well, right? Everybody has lots of people that count on them, which we don't realize.
Yeah.
So if you go down, the whole ship's off course.
Correct.
So what we have to do is see who we can put in place to take care, to make sure that care is. So one of the things that Care Answered provides is we let loved ones be loved ones so that we can be the advocate.
Right.
Because it's hard to advocate and be with somebody.
Right.
So there's lots of people that are the adult children that don't get the time to have tea or have a lunch with their loved ones and just be together.
Right.
Because they're like, oh my gosh, oh my gosh, oh my gosh, what do they need? I don't even know what they need. Those kinds of things.
Right.
So we're there to put those things in place so that you can be whoever you are to that person. So you can drive them to the doctor, but not feel concerned about, oh, I already know the questions to ask. I know what that means. I've been with my advocate. I know what all of this is happening. So then afterwards we go to lunch and we enjoy ourselves. So those are the big things. So then again, what we do is make sure we get those things in place.
Right.
So it's not like, oh, here are the things. Good luck.
That's right.
Some people do that. Some people say, you know what? Thank you so much. I have it from here. I'm going to call you when I need you, but I think I have it from here. But many times it's, I'm going to walk you to get all of those services and all that care that you need in place. So, for example, getting the long-term care insurance.
Right. Yeah.
Or potentially finding appropriate placement if it's a nursing home.
Yeah.
Or having a family discussion, facilitating family discussion so that everybody's on the same page. So
that's where your background in psychology comes in handy. Yeah.
I know people come and they're like, oh, but my family dynamic. And I'm like, I've seen it all. And then I say, I'm the youngest of six.
I get it. There's two comments I wanted to make. One is I like to distill things down to a simple, totally relatable example. And I've been having discussion with my wife for years, and she's blowing off this idea. We entertain, whether it's for holidays, parties, birthdays, whatever, and we can have 30, 40 people over. I said, hire somebody to serve and clean, and you could be a guest at your own party.
Yeah.
And she doesn't do that. and she is working her own party and doesn't get to speak to 3/4 of the people. That's exactly what you're talking about. I can go visit my mother without having to worry about talking to the head of the facility and the doctors and the this and that, and spend time with my mother as a mother. And it's a very relatable example because so many people entertain and don't bring someone else in, right? And this is what you're doing, but on a much more important part of someone's life and much more part of your relationship. So don't miss this part. It's so important. It's so beneficial. It's so comforting to know that somebody else was dealing with it. In my case, my sister was dealing with the logistics. She was, an hour and a half away. I was 10 minutes away, and she dealt with the logistics. Well, I dealt with the social part. My wife and I would be visiting my mom all the time, my mom and dad when they're both there, and we dealt with the aides at their place. But we didn't coordinate the aides if they had to call the facility company, and so on to because an aide wasn't working out or so on. They did that. My sister did that. So I had you, but I had you through my sister.
Yeah.
But between the two of us, and she's a psychologist, has a lot of people. So she has a background not like yours or like mine, and I had a background not like yours or like hers. But the two of us had a lot of stuff that we covered, a lot of material. But most people don't even have the luxury of that. And we could have used somebody like you, even with our level of experience. Somebody like you would have come in handy. And I didn't know you existed. And just a few years ago, I didn't know you existed.
Yeah, patient advocacy is a fairly new field.
Okay.
So it's so many times I would hear, "I wish I knew you when." I wish I knew you when.
Yes.
Fortunately, I hear that a little bit less now.
Right.
Because again, there's patient advocates all over the country and in Canada, and in other countries as well. And there's lots of groups that I belong to so that we can all get together and share different ideas. And different patient advocates have different specialties.
Right.
So that's so important to me as well. So not only my colleagues that provide all sorts of different realms of care that I work really closely with, because again, it's a team sport.
Right.
It's also really nice to have colleagues all across the country. So I'll have folks that either snowbird, right? So they'll be in Florida sometimes and then come back here when it gets too hot, and the other way around. And I can look through my partners in the field, and even though we work very separately, it's good to know that those people are also board certified patient advocates, which I am, so that they've gone through the process. And so I can say, okay, this is what's going on. There's sometimes that people are like, no, can you just hang out with me?
Right.
Meaning,
Yes.
can you just put me through this process? And I do. I've had clients in California. California, actually. California and Florida and North Carolina and different states, because the advocacy is the same.
Right.
It's not as much feet on the ground since COVID,
Right.
because they don't really want more people in settings like that, or even in people's homes. So we get it done, and that's our tagline. We get healthcare done, because that's what we do. We're not necessarily in people's lives for the rest of their lives. We do have a subscription plan, but oftentimes it's like, okay, help me figure all of this out, put things into place, and so that they can have the quality of life that they want.
You just opened up a door, path I was just going to go down. You mentioned a subscription plan. Two questions come to mind. Do you work with, most of your clients are some Medicare age. They're over 65 years old, I assume. And do you work with patients, clients, I guess, on Medicaid as well?
Yeah.
It doesn't matter to you?
No, because Care Answered is all private pay.
Okay.
So I know about the insurances, period.
Right.
But insurance doesn't cover our services.
Correct. I would imagine that. So that now
a lot of what I do is making insurance do what they're supposed to do. So they're not willing to pay me for that.
Then
The insurance company
they don't want to pay you for that. Oh yeah. I had a claim on a fire claim on one of my early businesses, and they would give me 10% of my benefit, and then I hired an adjuster. So someone to fight the insurance company, and I got 96% of my benefit. Mm-hmm. So clearly their job is not to pay out money, it's to collect premiums. So they're not going to pay you to collect their benefits. Yeah. No. And the second thing is if somebody wanted to know, they wanted to retain you, what do they expect from a fee? I'm sure it varies from soup to nuts depending on what they need.
It does. It does. So, what people call me all the time or contact me because I do a free consultation over the phone, just to see if we're a good fit for each other, if I'm going to be an appropriate solution.
Yeah.
And so from there, then we discern what they want. I kind of call it choose your own adventure, because there are going to be some folks that are like, okay, as I mentioned before, I know all the options. Thank you for this.
Right.
And I'm going to take it from here. And so then they wouldn't be as intense, right?
Right.
Because then I'm done.
Right.
And then other times they need me to steer them, guide them, walk them to the option that they selected. And then others, it's like, I have this problem and I'm going to do a shorter intake,
Right.
but I want to have the capability to contact you monthly,
Right.
to see if see if I'm on the right thing or the right route. And so one of my favorite things to hear is, I had you in my head, and they'll call me to tell me how it worked out. Like they had some sort of emergency or a small crisis, and they said, but I said, what would Nicole say?
Right.
And this is what happened. And so I love to hear that because, as again, I believe I said before, our mission is to access the best care for our clients while giving loved ones peace of mind and empowering all patients.
Right.
So not only with my book, which is called From Crisis to Calm, it came out in 2019, just before the pandemic, which
was it
didn't
good
know
time?
about.
Was it good timing or bad
It was
time?
crazy. It was actually crazy timing because all of the promotions and the speaking events were completely canceled.
Yeah.
But I was glad that I got it in people's hands at that time. And
People a lot more time to read.
Exactly. Unfortunately. It was a bestseller, and one of the reasons I wrote the book, well, the main reason I wrote the book, and published it, was to again expand that mission so that I could empower all patients, so that they can have a little guide, a little information, and recognize that they're not alone, because it has questions to ask,
right?
And then it's your own kind of healthcare notebook, so you can write down the answers, because people think that they're going to remember the answers, and they don't. They don't remember the questions either. Just we're human. We're human. It's taken us a year to get this appointment, or somebody told us we need this appointment right away. We still had to wait 3 months for it,
right? And
then we kind of forgot all the things. We know what the clinician probably gave to the other clinician, hopefully,
right?
Which is not always the case. But we forget, and we just want to get out of there because nobody really loves spending time with their clinician. Plus, each patient is only given 10, 15 minutes. So you need to be really prepared for any doctor's appointment. So it has all of that information and questions to ask and things to do, so that you can help become calm. And that's the reason why it's called From Crisis to Calm, because that was the most common thing I heard. Like, just talking to you, I feel much more calm.
So is the book about your experiences?
It's a how-to. So the full title of the book is From Crisis to Calm: A Patient Advocate's Take on Healthcare Coordination for You, the Common Caregiver. So it's very long.
I see why you have the abbreviated title.
From Crisis to Calm. But the point, exactly. But the point of it was, it's for you, anybody that's providing care. So one of my youngest clients was 2. So one of the things I don't do general patient advocacy for children, but this was an appeal. So insurance is insurance. So I do all appeals. It was this young girl had tumors on her spine, and she was in upstate New York, and the hospital and doctors didn't feel like they could do it. But their insurance didn't cover for, they spoke with MSK, Memorial Sloan Kettering, in the city, and they felt like they could do it. But the insurance said, we're not covering it because they can do it. It might take them more doctors and more time, and they don't have the experience, but that's where we're covered. So this was, this was this absolute crisis. And so I spoke with the mother and spoke with her about what can actually be done. So the key is, here's a secret about appeals, right? The key is not that MSK, Memorial Sloan
Right.
Kettering, can do it.
Right.
You need to prove that the hospital that is insured with them can't.
Right.
And so we went about that, and it got appealed, and she got her surgery, and they sent me videos and pictures of this beautiful girl. Because there's so many of those things that happen, and I can't imagine as a mother myself what that felt like, to basically being told that you have to have people that don't know, basically amateurs.
Right. Yes. So on your little daughter.
That you on your baby girl.
Yeah. Yeah.
On her brain
Yeah.
and spine. So so it's all of those things that happen, and they crush us. They can
Right.
crush us, but we're strong people.
Right.
People are strong people, but that doesn't mean you don't need help.
Correct. I'm glad. I was going to get to your book, but every time we talked about something, it led to something else.
I know.
So I'm glad you covered
conversation.
that. I'm glad you covered that.
Conversation.
It's funny you mentioned about this young girl. I have a 2-year-old granddaughter, special needs from the moment she was born, and we had an advocate for her. My daughter got an advocate, and when she was 10 days old, she was already receiving services. By the time she was 10 days old, and we went to a conference. She has Cri du Chat. We went to a Cri du Chat conference last year in Illinois, and no one at that conference is from New York, and no one at that conference had gotten care as quickly as our granddaughter, because we happen to live in a wonderful state that you can complain about in New York. It's not without its faults, but there are services here that these people just don't get. And she now receives 10 hours a week of different therapies. Well, since she's about just a few weeks old, she's been receiving 10 hours a week, and that's all coordinated through the advocate and my daughter, who's also an advocate.
Of course. All parents are.
You can't just sit there and say, I had an advocate, I'm done.
No,
that's not the job. As you said before, is it takes a village, to quote Hillary, who quoted whomever. I got to look who actually came up with that quote, but everyone gives it to her. I guess first time I ever heard it. But anyway, but it's being an advocate's an uphill battle. It really, it's a battle. You're fighting battles for other people who don't have the knowledge, the wherewithal, the time to do it. And it's I'm sure it's a very wonderful, fulfilling profession. I don't want to say wonderful, not that you're fighting all the time, but you get a sense of your help.
I'm also empowering people.
Right.
The thing is, and it's a gift. I love my work.
Right.
I've been blessed. Again, I blame my dad. It's
Right.
really a calling, and I feel very blessed to be able to do it.
Right.
Yeah.
So what's the best compliment you've ever received?
Let's see. That's a good question. Probably it's you changed my life, or you made such a difference.
Yeah, I can imagine.
Yeah, that's probably the biggest one. And because we all have our part.
Right.
That's why I feel so blessed, right? We all have our part. We change people's lives all the time just by smiling at somebody when walking down a street.
Right.
You have no idea each person's influence.
Holding a door for somebody.
Exactly.
People don't get
right?
it. Yeah.
Right?
I'm so conscious of that. Just putting your hand out so they can walk ahead of you online. Or...
Exactly, because you know how that makes you feel. Right?
Yeah, with 100%.
I know that makes me feel great. Somebody smiles at me when I'm taking my walk. I'm like, oh, how are you? It's just, we all have that ability to really make a difference in somebody's life. I'm just fortunate enough that every once in a while I get to hear it.
Right. I know you for the last couple of years. You're the president of GPNY, the Gerontological Professionals of New York, and that's how I got to meet you. And you're up there talking, doing your delivery. We've spoken briefly, but it's a room of 80 people. It's very brief. But now I'm across from you for over half an hour, and I'm looking at your eyes, and they say the eyes are the window to your soul.
Mm-hmm.
I see such compassion in your eyes as you're talking and telling these stories. I've never said that to anybody, but if you had no words, I could just see the story in your eyes, and I've never said that, and I think it's the best comment I can give you for what you do.
That's a beautiful thing to say. Thank you so much.
You're very well. It really, really shows. And I've never said. I hope I don't get in trouble. My wife saying to another woman, but well, she probably won't listen to this anyway somewhere. Right? but what would you say? It's a good place to go. Well, first one functional question. Where could somebody get your book? And then I want to go with my closing question.
Sure. You can get my book, as they say, wherever books are sold.
Wherever books are sold.
Basically wherever books are sold, Barnes & Noble, Amazon, and even some little bookstores, and even in libraries. So
okay, there you go. There you go. And we covered so much material. What would you say is the number one takeaway? If you just didn't say, if you could listen to 1 minute of the show, what would the one takeaway be somebody should get from this podcast?
I would say, don't do this alone. Don't do this alone. You're not alone. Get a patient advocate. We're here to help.
That's exactly what I would have said. And where can they reach you?
They can reach me on our website, which is careanswered.com, or you can give us a call at our 516-584-2007 number. Or on social media, you can find Care Answered. We get out a lot.
You get out a lot. You'll have more material to put out there now with the podcast.
Yes, absolutely.
It was a real pleasure.
It was a pleasure speaking with you. Thanks so much for having me.
Same. Thanks for coming. Thanks for listening to this episode of the Unlocking Senior Resources podcast by Leave the Key. If you've enjoyed this episode or found it helpful, don't forget to subscribe, leave a review, and share this podcast. We specialize in working with seniors who are transitioning out of their homes, and we understand what you are going through. So if you are considering selling your home and would like an alternative to the traditional overwhelming process, reach out to see how we can help. When working with us, you can sell your home in its current condition, there is no need to remove unwanted items, and you control when the house is sold, along with so many other advantages. Visit leavethekey.com or call us at 631-388-7771 to learn more about our senior home buying process.